Well, good evening, everyone. Welcome to Tustin Longevity's YouTube channel. We are on every Tuesday at 6 o'clock, and we are working to try and increase accessibility and other venues because it's getting to the point where I'm not able to answer all the email questions along with the live chat here. But again, this is September 26, 2023, Tuesday evening, 6 o'clock, when we always meet. This is designed for educational purposes where patients, friends, people can ask generalized questions from us doctors here who practice conventional medicine, but we have a tremendous amount of experience with the functional integrative alternative medicine. We have 8 or 9 healthcare providers here, MDs, naturopathic doctors, uh, and nurse practitioners, and physician assistants, and we have new counseling support as well on a limited basis, and we are looking at a doctor of osteopathy. So we are going to go through the questions on the email. When I see on the YouTube, if you type it in with the live chat, I'll do that. Very often these are transcribed so that if you come back at a later time, you're able to read through it topically and find the ones that interest you. And if I'm able to add on more time or another venue, we will do that. This is at the end of a long day of work, and of course, my morning workouts and everything. So it is taxing, but I do think it's valuable, and I want to continue this. So if it is valuable to you, I would like for you to hit the like button and subscribe and share. And we'll try and hit these questions rapidly, and hopefully I can at least catch up today. So the first question is on the email list here from Desiree, and she said, "Hi, I recently had H. pylori. I took the antibiotics, but since then I haven't been 100%. I feel bloated at times. My stomach will hurt after eating certain foods. I've lost a little weight at times. I'm not taking anything besides probiotics. I have changed my diet a lot, but still don't feel like I'm back to normal. Please advise on anything that can help heal my gut. Thank you in advance." Well, Desiree, I would want to know your age and background, of course, but for H. pylori, that's the bacterial infection of the gut that's treated usually with a double antibiotic and antacid therapy over a week, 10 days period of time. Usually this will kill off the bacteria. It doesn't mean it won't ever come back. And you'll have serum positive antibodies. And I don't find any particular blood type that happens to more than the other. But blood type does matter for having a healthy gut because the A-type blood is generally having a less amount of stomach acid and betaine hydrochloric acid. And so with that inefficient digestion, there tends to be food prolonged and held in the stomach. And this is complicated by our high carb diet. And these sugars tend to feed the bad bacteria, the opportunistic bacteria, and we start getting all these problems. So we have to always ask the question when we're looking functionally, is the body designed to defend and heal itself? And the answer is yes. So if the body is designed to defend and heal itself, what are the first steps? Well, the stomach acid is supposed to be good enough to be able to kill off any bad bacteria, fungi, or virus that would come into the stomach. Our stomach pH could get down to as low as a 2 or a 1.5. Even the pylorus at the end of the stomach, before it opens up to empty the stomach into the duodenum, is waiting for a pH to drop low enough And if it doesn't, it's going to keep food in your stomach longer. And if you bend over to tie your shoes or shoelaces or something like that, you'll maybe get some backup burping, regurgitation, reflux into the esophagus. And if your pH is only a 4 or a 3.5, that acidity is going to be picked up by your esophageal sensors for generalized pain, and you'll perceive this as discomfort and heartburn and chest pain and heartburn. So stomach acid has to be adequate, and you have to take a digestive enzyme that has betaine hydrochloric acid with the enzymes in it, and we use the orthodigestzyme, or what we private label here is the Proven MD digestive enzyme, and it has it in there, and I would take 1 or 2. Sometimes I'll take 3, 4, or 5 if I'm eating a bigger piece of meat or steak. The older I get, the more I found I needed. The other thing that the body does naturally to defend itself is the gut is lined with all types of lymphoid tissue. It's called the gut-associated lymphoid tissue. And if the very delicate membrane here, see this double membrane here, and here's a little hole in it, a breach. If it's breached, then material from the stomach can abnormally pass in to the gut wall and then into the inside of your body, and that alarms your immune system. And you can waste your immune system and develop allergies to foods that normally you wouldn't. So what we say is, how do we protect that lining? Well, we protect it by eating in a mature adult self-governing way, in that we don't eat late at night. We try and have 12 hours at least of an empty stomach. We try and take the components that make up this membrane of our gut and every membrane in our human body, and that is made of protein and fat. Phospholipids, these double layers, top and bottom, it looks like a little sandwich here. And wherever there's a breach or a hole in that, these phospholipids arrange themselves. So, and you get them from the egg yolk, you get it from the meat, you get it from the chicken and the skin on the chicken, the pork, the shrimp, the lobster, the crab, the bacon, the meats. And when we eat this and digest it, then we repair these areas here. And so we're able to recover. And the gut is very good at repairing. In fact, every 3 days, there's pretty much a new single layer, and it's only 1 cell thick. So we're designed to heal. We have to have the stomach acid and the digestive enzymes. We should not eat late. And we should not eat processed foods. We should not eat high sugar foods, because the sugar, carbohydrates, and fruit sugars will depress our immune system, which will allow the bacteria and opportunistic commensal biofilm to overgrow. And this then will promote illness. But we're designed to heal. So what we use is the phospholipid powder. It's called phospholipid powder, and that has these very phospholipids in it. And I think it's also called BioPC Plus. That's from Orthomolecular. Ours has a little more stuff in it called phospholipids. We put some other things in our phospholipids. Mix it in some warm water. Take it like a hot, a hot toddy, a warm drink, not a hot drink, because fat will dissolve into warm water. And then drink it at night and drink it first thing in the morning, so that you have all this healing material that's going to repair the lining, all these little holes here. And that should be a big help. You already said you're on the probiotic. So the probiotic is very beneficial. And that's the way we were designed to heal. It could be that you should go carnivore for a month or 2, where you're just eating totally carbohydrates, severely lowering the sugars, so that you amplify the healing message and the supply of the material here. And then, of course, use your digestive enzymes when you're eating all that meat, fish, chicken, turkey, beef, eggs, and butter and things like that. Um, Outside of that, exercise is beneficial, eating in a 6 hour window, so using your stomach less. All these things should work along with the way we were designed to heal and help you. Hopefully that's a help to you, Desiree. Diane asked the next question. Hi there. I have a dear friend who lives in Dubai. She's 30 years old, who after a ultrasound was told she has mild polycystic ovarian syndrome. She has been trying to conceive, get pregnant for 2 years with no success. She tracks her cycle with an ovulation detector kit, which never peaks. Her follicular phase is very long, and the entire cycle can be 40 plus days long. It seems she is not ovulating. Her insulin is 9.2. Bingo. She's a high carb person. High carbs create polycystic ovarian syndrome. It's that insulin stimulating tissues that are very responsive to growth and development, and polyps and your breasts and your uterus, fibroids. All this is driven in by a high carb diet. She would be a perfect candidate for a carnivore diet to heal quickly. Let's finish the rest. Could this be the reason she has PCOS? I already said yes. Her primary doctor in Dubai wants to start her on birth control pills. I don't know why he would want to do that. I told her not to and seek out a functional medicine doctor in Dubai. There was to be a more holistic approach than birth control pills. Is bioidentical progesterone an option, and how would she go about that? Where could she start to regulate her cycle? Well, I would, ask her to find a doctor who will use natural progesterone. You can buy it over the counter at a low dose concentration. We have Kokoro here. It's about 25 milligrams per gram, and it is allowed to be sold over the counter. I would have her use it 15 days after her menstrual cycle starts. And if it is the low dose over the counter, I would take 4 pumps to 8 pumps and rub it on her arms and legs as a moisturizer to try and get the progesterone level up, and do that for 10 days from the 15th day from her period starting to the 25th day, and be on a carnivore diet. And I would encourage her to be on a very good multi-mineral vitamin. We have the TLC Energy Core, vitamin D 10,000 with K2, iodine, the iodoral 12.5 milligrams, and a multi-mineral. We use TLC Multimin. It's got the zinc and the magnesium and the potassium and stuff like that in it. Along with systemic enzymes to help chew up those cysts. I would take the enzymes on an empty stomach first thing in the morning, 4 or 5 once a day. And then in time, and it'll take 2-3 months, she should be ovulating, and then she should be successful. So that's how I would proceed. Find a doctor that will work with her and maybe prescribe progesterone. She can get a prescription for 100 or a 200 milligram capsule and take that day 15 through 25 as well. And this will promote her health. But again, find your doctor. These pieces of information are meant to be general guidance, not individual treatment advice or medical practice over the YouTube. But this is how I would begin to think about treating someone with that. And she's got to get out of that pre-diabetic range and move to a carnivore diet to dramatically stop the impulse that is creating insulin from those carbs and stimulating the cysts so she can't ovulate. Diane asks, do you advise a person in their 70s who has had chicken pox as a child to get a shingles vaccine? No, I don't. And I can't give an informed consent for it. because the manufacturers and many of the concerns about lawfare and stuff and their openness has come into question. And so to give informed consent, I would have to have answers. And so with so much questionable litigation going on and challenges, I would not be able to give informed consent. Now, on the reverse of it, for myself, I'm at 70 and I won't take it. Now, why won't I do that? Because my immune system is supposed to protect me. So how do you protect your immune system becoming an older adult? Exercise is one way, and older adults don't exercise with lifting heavy weights, upper and body, which is the muscle stress that you go through with a weight training program. The little myosins that are generated, the stimulation stimulates the immune system. It lowers the blood sugar, and bringing the blood sugar down helps the immune system, because we know all diabetics, high blood sugars will lower the white blood cell and immune performance in a human being. I would eat on a restricted time phase, never eating late, because 80% of your immune system lines your gut. So if you want to stay healthy with aging, you want to not eat past 6 o'clock at night. I even try to not eat past 5, and eat in a limited time, rich in protein and fats, because white blood cells are made of protein and fat. The cell membranes are made of protein and fat. And a low carb diet, lots of protein, and exercise, and plenty of water, and take vitamin D. Have your doctor check your level. I like to get the units to 80 international units per deciliter, and then have them check your blood sugar, hemoglobin A1C, insulin, triglyceride, and fasting blood sugar. And if those are all in the safer ranges, ours are lower. Our fasting blood sugar is 85. Our triglycerides, we want to be no higher than the high density lipoprotein HDL. So that's roughly around 50, 60 on the triglyceride. And triglycerides are the simple fats that you make from consuming too many carbohydrates. Then we want the insulin under 4 or less, and we want the hemoglobin A1C 5.2. So that's what I suggest. I also recommend getting a multi-mineral in that has zinc in it. We have the two ways, and you could do both, the TLC Energy Car multivitamin, and then the TLC Multimin that has higher dose magnesium, potassium, and zinc in it. Zinc is very valuable. And then use the quercetin, which acts as an ionophore to help get the zinc across through these membranes here that you're repairing with a healthy, protein-rich, healthy fat diet with the essential fats in them. And that zinc gets then into the inside of the cell, and it will stop the replication of viruses and so forth. A good night's sleep, reducing stress. Exercise helps you reduce stress. These are the ways to think about lowering your risk for shingles, not thinking some injection from some company that may have dubious leadership and quality and lack of transparency as your resource. Cynthia says, good evening, Dr. Rita. An internal ultrasound found a 4.1 complex cyst with septation on an ovary. The gynecologist said it will go away on its own, but if I'm worried about cancer, we can proceed with surgery, as that is the only way to know if it's cancerous. Does that sound correct? That's true. I requested an MRI, but was denied. Again, in this situation, please work with your gynecologist. We get concerned about complex cysts that have material in them and septations and stuff like that. This tends to have a higher rate of becoming cancer, especially larger cysts that are over 4 or 5 centimeters in diameter. You could do a CA-125. That is a tumor marker associated with ovarian cancer. But again, all the things I mentioned to stay healthy, a low carb diet, exercise, enzymes, systemic enzymes, zinc, a good amount of vitamin D, drinking plenty of water, eating in a time restricted area, and natural progesterone, cyclical natural progesterone, or even continuous progesterone will help suppress any stimulation for these cysts. But if it were up to me, I would tend to go for the surgery, but you work with your doctor and maybe check some of those things, certainly a CA 125, and do repeat ultrasounds in a short period of time within a month or two to make sure it isn't getting bigger if you are going to choose to wait and see. But please do follow that up with your doctor. I would tend to go for surgery. Lori asked the question, hi, Dr. Rita. Thank you for all that you do. You are a blessing. Well, thank you, Lori. I've been dealing with a skin condition for the last 4 years. My palms and fingers and ankles itch till several layers of skin peel off and have open wounds constantly. Have been to several doctors and specialists. None can figure this out. The biopsies are coming back inconclusive. Seems like my body is boiling inside out. Suggestions, other tests I could consider? Thank you. Well, this thicker skin on the palms and the feet is not something that we don't see from time to time. These are areas that do get more trauma when we're touching things and walking on things, and our feet sweat, and God has allowed us to build up a thicker layer of dead cells on our feet so that we have more protection from the damage of walking and the trauma and the crunching of the bones and the tissues like that. Now, as we get older, the circulation to this constant area of trauma, the little tiny, tiny, tiny hair-like capillaries become damaged. And when they become damaged, repair and delivery to help repair all the cells that are in between your bones and your feet and your toes and between you and the surface of the skin, that capillary layer in the skin gets shorter and shorter, and then the skin gets thicker and thicker and dried out, especially if you're not eating well and eating a high carb diet, which most Americans are not eating well, and too high a carb, and they're eating processed food. Because if we're going to repair the lining of the inside of a little teeny tiny capillary, we have to be low carb. We have to eat the protein and fat that that cell membrane is made of. We have to drink enough water to get the hydraulic pushing through and healthy osmotic pressures and the electrochemical charges that draw things in through these delicate areas. And to feed your feet and the tissues and your skin in your body, you have to have a wonderful capillary bed. Eat the same solution for everything in the body is the same solution for everywhere in the body, whether it's your feet and excess thickening or the trauma you give to your hands all the time from using them so much. We would recommend EDTA chelation therapy to enhance that microchelation, microcirculation to the capillaries. We would recommend the low carb diet. We would recommend a rich protein, healthy fats, more like a carnivore diet to keep the sugars low. We would recommend the enzymes to chew up the debris in there. And we would recommend plenty of water to keep your circulation half your weight as pounds, as ounces every day. And then we would not get wet. We would try and let the skin dry and flake off over time, getting those healthy oils in. Then we have people who are just very poor at digestion. If you're a blood type A, you might not be digesting well. So take the digestive enzyme. But something else that we use are the essential fatty acids. This is clinician's preference. This comes as a liquid too. But these oils are the linoleic like in this picture here, that hug the hourglass you can see right there. These essential fatty acids hold the protein receptors for the proper behavior of the cell. That's the sensory perception of the surface of the cell are the membranes, and those delicate oils are in this material here. And it's not fish oil, and fish oil is for a fish, and we're not fish. So I disagree with that fish oil push. And that's how I would begin to work on that, Lori. Joanna says, my daughter is 28 and started having really bad pain on the first day of her period 4 years ago. It does not happen every cycle, but when it does, she gets very nauseous and lays on the floor for about an hour until it gets less intense. Symptoms include blurred vision, numbness of the hands and feet, throwing up, diarrhea, and severe cramps. She is confused why it only happens on the first day of her cycles and it only lasts for about an hour. Well, a woman's menstrual cycle is a time when there is in the lining of the gut, the lining of the gut is the lining of the uterus. You're going to have a disengagement of the bloody lining to come out, and that disengagement of that buildup of that lining means it's like breaking a scab in a way. It's like ripping off the scab on your knee if you cut it or something like that, so it can bleed. And that process where the blood vessels pinch and recede off and let the slough is an inflammatory period. This is why inflammation goes up in a menstrual cycle. The first day is the worst day. And so eating a very healthy diet, plenty of water, as you anticipate the day when your menstrual cycle is going to start, I would start using systemic enzymes or be on them all the time, like Vascuzyme or Vitalzyme, and push extra water and push extra anti-inflammatory oils. This would be a good oil or a teaspoon of it every morning. And be very, very low carb and eat a one menu day, especially as you get near the beginning of your period. That should be a time when a woman is very careful to eat a very quiet, uncomplicated, unspicy, wild, entertaining diet, because it's inflammation to shed the lining of your menstrual cycle. And that's how I would begin to do that. Kathy says, hi, Dr. E. Is it okay to take the systemic enzymes at the same time as thyroid NP in the morning on an empty stomach? Yes, Kathy, it is. Amela says, my daughter's 14. She got her first period about 6 months ago. Her cycle is irregular. That's not unusual. She gets her period every 40 days and sometimes skips a month. I know they say it's okay for the first 2 years to have some irregularity, but I'm trying to see if I could help her. Can I have her use Cocoa progesterone cream? Yes, so. If so, how many clicks? I'm not sure if she is too young to use progesterone cream. Thank you so much. Yes, she can use progesterone cream. And I tell mothers today, the stress on young ladies today is probably the worst I've seen it in all my 42 years of practicing medicine. So getting some over-the-counter progesterone cream and using it day 15 through 25 of their menstrual cycle. And progesterone can get on a man. Progesterone and boys and women is fine to mix together. So even dad can remind her and put a squirt on her, rub it on her arms and legs, do that day 15 through 25 of her cycle. And then she should come around and start having a more regular ovulation. Now remember, ovulation will not occur if there's a lot of stress. Remember, the mind, pituitary, cortisol stress will inhibit follicle stimulating and luteinizing hormones. So it is a stressful time in the days and months and years ahead. So getting a good night's sleep, being reassured by her parents and her father, using the progesterone, being on a healthy diet, which is the low carb diet, drinking plenty of water, and eating, shutting off eating by 6, 7 o'clock. Late night eating is stressful on the body. So these are the things that I would tell her, Amila. Tiziana says, hi, Dr. Rita. I heard on a podcast that if you take too much of the wrong magnesium, it will leach calcium out of your bones. Is that true? I don't know that that's any real truth statement. Would the high levels of magnesium show up on a blood test? Well, we could do a serum magnesium level. We could do a red blood cell intracellular measurement of it. Would the high levels of magnesium show up? Also, they said that sodium-based electrolytes, salts, such as in a product with 1,000 milligrams of sodium, 200 milligrams of potassium, and 60 milligrams of magnesium, when used on a daily basis, will dehydrate you instead of hydrate. What are your thoughts on this? Thank you. I don't, how do I say this? We think that being healthy is you have to be a chemist with a white coat on and bubbling and everything. I would salt your food to taste. I would use Himalayan salt, mined salt, because the atmosphere has pollutants in it. So you want to get salt from a mined source, we'll study where the salt comes from. Red salts and Himalayan salts that are mined are good. So salt to taste. If you are a high performance athlete, you're working out or you're doing hot yoga, then salt your food more heavily to taste. But adding salts all the time can create a hypernatremia, too much of ionic material, and the tendency of Americans is not to drink enough water. So I take my salt that I have right here, and I got it from Sprouts this time. This is the Himalayan. And I tend to put a dash into my waters, and I use it on any of my food. And I make sure I drink enough water every day. Now magnesiums that are good typically are amino acid chelates like magnesium citrate, magnesium glycinate. Magnesium sulfate kind of smells funny. That's that stinky sulfur smell. And if you take too much magnesium, you're going to get diarrhea. So we never see problems of people abusing magnesium, because if you take too much orally, you're going to get diarrhea from it. And then that'll be over with. You'll stop doing that. So salt your food, get mine salt, drink your water as you should, and salt your food a little more if you're an intense person with a lot of exercise. And I wouldn't go trying to find extra salt or materials. Taking a good multivitamin mineral, we have the TLC multi-mineral. That's a standard dose. That should be all your body needs. But yes, we can test the levels. Jennings says, I have been on a carnivore diet for just 3 days and have had great relief from gastrointestinal issues. No more gas and pain. Bowel movements are now normal. Well, thank you, Jennings, for telling us that. And that's the healthy diet. That's what we're made of. We're made of protein and fat, and that's what all your cell membranes are made of everywhere in your body. Vanessa says, I'm in my early 40s and was told I have breast calcifications that have been growing. What causes those? Is there anything that can be done to prevent, reduce further calcifications? What about preventing those calcifications from turning cancerous? Thank you so much. Well, Vanessa, live a healthy life. Now, every area in your body that's traumatized. And so if you've breastfed several children, when you're intimate with your spouse and there's trauma to your breasts, these micro traumas to your breasts can generate little cellular damage points. And if it happens over and over in the course of a lifetime of a woman, these little micro damages will attract calcium deposits. We do not recommend taking extra calcium supplementally as a general rule. We have seen people take god awful amounts like 1,500 milligrams of calcium, thinking that they're helping their bones. We get all the calcium we should really need eating our meat, our fish, our chicken, our turkey, our pork, our eggs, our cheese, raw, and crustaceans and things like that. What I would tell you is we get rid of microcalcifications in the breast from the micro trauma of a lifetime through EDTA chelation therapy. So we do that. I had that in the past. I've had 2 mammograms in my lifetime. I'm 70. I did my first one when I was maybe 38. I was on active duty, and I guess they told me to do it. But anyway, I had one, and they saw microcalcifications then. I did it again one more time when I was 58, but I had done a lot of chelations, and they were all gone. So if we live a life where we're trying to eat healthy, repair our cell membranes with the healthy fats and proteins we're made of, take systemic enzymes to reduce inflammation, low carb to reduce inflammation, drink enough water, exercise our body, get the hydraulic pumping going on, get a good night's sleep, and improve the tiny microcirculation with EDTA chelation that pulls out heavy metals. Find a doctor in your area that can do it, or contact us and we'll try and help you. That's how I would get rid of it. And that will help prevent cancer, because what is cancer? It is not a genetic disease. It's not caused by hormones. Cancer is a mitochondrial metabolic disease. And when you mess up all the time, choking up your capillaries, choking them up with high carb sugars, creating microtrauma and inflammation, then the mitochondria are spitting out all these reactive species, and they flip into a more anaerobic facultative metabolism, and that can talk epigenetically to the DNA, and the DNA can revert back into a more primitive survival form that we all came from, and start to grow independently, depending on a high carbohydrate diet to grow cells and new capillaries. So that's it. Look up Thomas Seyfried, Seyfried, or EID, PhD, and on YouTube it's called Cancer is a Mitochondrial Metabolic Disease, and it is just not a genetic disease, and that should be put to bed. Amela says, hi, Dr. E. The vitamin D 5,000 international units K2 that I'm currently using has a combo of K1 and K2 in 1,000 micrograms. I know you mentioned before that MK7 is the good form. It has a longer half-life, MK7 over MK4. Is 1,000 micrograms of MK7 too much? I wanted to make sure for the dose. Well, I don't know that there is a upper limit on that dose, but I have really never seen a need for anything over 300 micrograms of the MK7. So that would be the brief answer there, Amila. Vicki says, my 42-year-old daughter was recently diagnosed with diffuse systemic sclerosis. Do you have any dietary suggestions to help cope with this disease? She's currently on methotrexate, which is a form of chemotherapy, and I am concerned about the side effects of that medication. Well, yes, I understand. So we have many scleroderma patients with systemic scleroderma. That is a more generalized form. The skin tends to have an autoimmune, and it becomes stiff and unflexible. Well, what is your cell membrane supposed to be made of? It's supposed to be fluid and flexible and soft, and it's supposed to be made of fat and protein. And these protein receptors, here's a protein receptor, the outside of the cell, and this would be the inside of the cell here. They're supposed to have these fatty acids holding that protein in place snugly. And these would be the phospholipids here that you're seeing down on these areas here in this colored picture. But these phospholipids and the bottom ones are there, and there's very special fatty acids that hold receptors so that they can get proper perception and receptor effector for healthy cell behavior. If we eat a diet that is inflaming because they genetically modify things, they market them and resell them and pimp them out to us through marketing, eat your McMuffin and eat your cereal and eat your pancakes and eat your sourdough bread at Subway and eat your spaghettis at night and your pizza crust at night, you're getting the same food that's genetically modified, very likely, over and over and over and over and over and over and over again. And this is coming down your throat. It's cracking through these little breaks, the leaky cell membrane, the leaky gut, and your immune system lining it is inflaming to it. And then this autoimmune attack occurs, and it's associated with many different expressions. It could be rheumatoid arthritis, it could be psoriasis, it could be multiple sclerosis, it could be many various forms of autoimmune, and scleroderma is basically just one of these. Now, if she would become a carnivore, she would immediately be removing all the genetic modified plant-based plant toxins, and then she would be abundantly supplying the repair material to make herself with. But she probably already has some of the poor circulation. Raynaud's syndrome often goes with that. So she needs EDTA chelation therapy to try and get that capillary system rejuvenated and to restore and repair and remove debris. She needs to be on high dose systemic enzymes, like 4 or 5 on an empty stomach, morning and evening. And she should be on those healthy essential fats so she can hold in these proteins here correctly. And she should be probably on the phospholipid powder with SBI Protect, which helps the immunoglobulin A to really quiet the gut. And then on a carnivore diet, she needs to exercise. She needs to eat in a 6-hour window of time. She needs to be on her vitamin D. She probably should be on a good multivitamin mineral like the TLC Energy Core. And I would probably leave it at that. That would be working on all the things that the body is designed to heal itself, but it has to have a capillary, and EDTA chelation will help with that microcirculation, and that's what I would do for her. Let's see. The next one, Katerina. Years ago, I saw a naturopath who was helping me with my Hashimoto's, and he had me take bovine adrenal cortex. All right, so you were taking some cortisol by taking the actual gland for my afternoon fatigue. It was fantastic. Then I saw an MD and a general physical, and she noticed on my chart I was taking steroids by taking this supplement. Yes, it is a form of steroids. It kind of scared me off from taking it. What is your opinion? Is this a safe supplement to take daily for afternoon fatigue? Well, this is usually put out by supplement companies that deal with glandular animal extracts. And so the adrenal gland is where cortisol is made. Cortisol is a steroid, and this is helpful if you've been so understressed and so wiped out and your DHEA is low. It could be a help. Now, the thing I would use, and I don't tend to use adrenals from that animal source, is I use the precursor, which is DHEA, dihydroepiandrosterone, the precursor to your cortisol. And then I would follow the patient. I would do a cortisol beforehand in the morning and in the afternoon, and then I would give the DHEA, and I would check those levels and their testosterone level. I would tell them to do all these healthy things and exercise and drink their water and low carb and eat the rich phospholipids. Cholesterol makes up your hormones, and it is also important for making cortisol and all these other derivatives. So that's the direction I would go. But I don't know that it's harmful by using these glandular bovine adrenal cortex, but I'd have to measure it to know. Katharina also said, your monthly newsletter addresses bruising easily, may be a source of lacking certain vitamins. I've always bruised easily. I have used arnica cream right after trauma, and that would normally lead most people to bruising, but she has successfully gotten very little bruising, and it's been wonderful. Could you suggest what vitamins and dosing would be helpful, or blood work if deficiencies? Well, in general, as we age, our skin thins, and all of us begin with thinner skin. The capillaries are closer and closer to the surface, so any bump can create a physical trauma and a bleed. So the older you get, the skin thins, and you can see all these bruisings. And as capillaries die off, the retrieval of the debris is harder. Enzymes are made less as we age. So if we take enzymes systemically, if we drink enough water every day, if we do some hydraulic exercising every day, if we get a good night's sleep, and we take the healthy tissue material, phospholipids and healthy fats, linoleic and alpha linoleic acid here, and we use our hormones, then you should, with aging, have thicker skin. So I feel I've done quite well. I don't think I have as much bruising that you would anticipate at 70. So we are now, I'm at the age now, 42 years practicing, that even in myself, I am seeing the energy, the longevity, the joint health, the skin health, the hair health, because I'm all natural. There's nothing synthetic, hair dye, nothing on me. And I do believe that this is a result of this lifelong healthy living that my father in food research told me about. Amela says, Dr. Ellithorpe, is it okay to use EDTA suppositories 3 days in a row? Yes. Or is it better to spread it out during the week? I don't think it matters. How long does EDTA stay in the system? Our pharmacokinetic studies showed that it lasts a little longer because it goes through a biphasic re-entry because it's in the gut. So it's going to last more like 16 to 18 hours, whereas an IV is about 6 hours. But I would never see a risk for overdosing with it. Dorothy says, what are the best ways to strengthen the pelvic floor for women? Well, we lose our hormones, the skin thins, the uterus then is hanging on the pelvic floor, which is a thinner membrane. And then if there's sexual activity, there can be straining on the tissues that are thinning out. So natural hormone replacement therapy, eating the foods that make up healthy cell membranes, and then those natural hormones will help thicken even the skin all throughout your bodies and your bones and your cartilage, all that. And if we give you some vaginal cream like estriol with testosterone, we could put a little bit of testosterone in there, which will help that musculature of the pelvis be tighter and firmer. So if you practice Kegel exercise, trying to stop the stream of urine, breaking it, squeezing it down, then you should see improvement, and that should be a help. Lorraine says, I have had COVID and I'm no longer positive. However, I am very weak and have had a lot of body aches and morning congestion, nasal drip. How long do these symptoms last? And also, I've experienced a groin pull. Do I see orthopedic or a pain management person for that? It hurts to lift her leg, and she is seeing Dr. Merrick. Well, the older we get, the slower we heal. The less capillaries we have. We eat less of the healthier, rich proteins and fat because we don't make as much digestive enzymes. We don't have as many betaine hydrochloric acid produced, so we move to more carbohydrates. We lose our hormones for repair, so we're more easily stressed. We get tired because these holes in our cell membranes allow leaking out and inflammation in our body, which adds to the weakening of the tissues, and we constrain ourselves and we don't drink our water. So it's a pathway to death. So all I'm doing here is teaching my patients that you were designed by God. The design plan works. The blueprints are great. Let's cooperate with the construction plan and put the right material for building our bodies in it. Let's cooperate with the cleanup crew and our laborers at the site. Let's listen to the engineer of God and the way he did it. Let's get a doctor that will work with the big picture and with the fact that we will heal. I do workouts 5 days a week. I pulled my inner groin on my adduction on against weight, so that my right inner thigh, it would hurt me to lift it up. Well, I just took it easy. I dropped the weight in half, and I fasted for a day or two, took more systemic enzymes, and I'm slowly building up my inner thigh again. And that's what you have to do, Lorraine. Sandy says, hi, Dr. E. Recently, an ENT recommended I start using daily saline rinses and Flonase for sinus pressure, which he says are from allergies. It seems like it helps some at first, but I'm still having symptoms. I do take quercetin daily. I have used Argentin 23 nasal spray and often the past few years, especially when going out in crowded areas. I'm going to be in some large crowds soon and on a long flight. I'm wondering if I can still use it with Flonase. The answer is yes. If so, how long after using the Flonase? You can use them at the same time. Thanks so much. So the older we get, the thinner the tissues, even in the concha, which build up our sinuses. So if you breathed in some pollens when you were 20 years younger, you had a thicker membrane and the mucin and barriers were stronger and you wouldn't have been affected. So we thin out everywhere, even in the lining of our gut. And so it's so important to eat healthy, to build up, to exercise, to drink your water, to take your enzymes. And Argentin silver is a natural rinse and a natural gentle silver antifungal, antiviral, and antibacterial. Taking the vitamin D helps your immune system. A low carb diet will help your immune system. So you see, God didn't make this complex. We just don't want to hear it, that it is our responsibility to take care of our own health. Debbie says, what is your best advice for parents to build up their children's immunity with fall coming when kids do get colds or the flu, and what's the best remedy or treatments? Well, I would absolutely pack their lunches, because the American Dietetic Association is destroying the health of America with their horrific high carb, high cereal, high juice, high sugared up drinks, and microwaved material that is absolutely damaging to the immune system. So pack your children their lunch. Tell them you're trying to preserve it. As your young boys go into puberty, you're trying to help them build their muscles. And for the girls, you're trying to help them and their brothers not have acne. So a low carb diet, pack them some protein, whatever dinner was. If you had turkey, if you had beef, if you had chicken, if you had pork, if you had lamb, if you had eggs, if you had fish, shrimp, put the protein in there, put in their vegetable, and put in some nuts and seeds, and maybe some carrots to munch on, and that's enough. We do not need this foolishness of having all this carbohydrate, starch. Good food becomes bad food when there's too much food. So what that child needs to grow up is protein and fat, and we need to emphasize that. So pack their lunches, give them vitamin D. There's liquid drops, or they can swallow a piece of a hamburger or pizza. They can swallow that little capsule of vitamin D. What do I think the dosing would be? For toddlers, I usually give them 1,000 international units a day with vitamin D3. When they are maybe 50, 60 pounds, starting school, then I start giving them 2,000 international units. When they're about 80 pounds, I treat them like an adult and I give them 5,000 international units a day. And as they get into heavier weights, 120, 150, 170, I make sure they're somewhere between 5 and 10,000 every day. I have their doctor, their pediatrician check their level. I feel very safe between 80 and 120. I have them do the chemistry so that they can look at the liver enzymes because vitamin D is a fat-soluble vitamin. So lower their carbs, give them the D, give them we use here in our clinic Juice Plus. It has the most research nutraceutical on children. We have millions of children and parents filling out outcome reports on their health, their doctor visits, the medications, their allergies, constipation, academic performance, athletic performance, and others throughout the world in many different countries, many different socioeconomic groups. And those who are on the Juice Plus are avoiding all the starchy sugars and fruit sugars. They're getting the phytonutrients of the fruits and vegetables, and they're taking that. They're eating their otherwise routine diet. But if you emphasize the healthy meats and fats, you give them the D. And I would, if you want a very intelligent child, I would give them one tablet of 12.5 milligrams of iodoral, which is the iodine, and you'll have an intelligent brain, immune system that's up, sugars are down, athleticism and academic performance is up, and their allergies and colds and asthma should really be a thing of the past. Let's see what the next page is. Let me see what we have here on the chat. So Christina says, hi, Dr. Rita. Sometimes I can feel my heartbeat in my back. Is this normal? I'm 39. Never had any serious health issues. Eat mostly healthy. She goes on to say, my son and I have a virus for the last week. His voice sounds hoarse and has a slight cough. That sounds like mucus in there. My lymph nodes in the neck feel off. What can I do? Thank you. I would fast. The minute I get sick, I stop eating for a day and a half. Because your body is designed to handle most things. So I would be fast for a day, just have chicken broth, take vitamin D. We have the high dose for 5 days, the 50,000. And then take the TLC multivitamin that has the high zinc in it for those 5 days as well. And then be on only a carnivore diet if you do eat anything, so that your sugars don't go up and your body can fight off this with the zinc and the vitamin D. And then I would get Argentine silver. I would spray it up your nose. I would take a sip of it and gargle and swallow it 3-4 times a day. In the course of a week, both of you should be much, much better. I also would be on Juice Plus. Harlow says, good evening, Dr. Ellithorpe. How can you treat a fatty liver? What supplements do you recommend? I would treat the fatty liver with an extremely low carb diet, meaning I would go carnivore. That is the best way to lower it because fructose is processed through the liver, and the high carbs, starches, and fruit sugars are going to put a burden and create triglycerides, which will then create a high tiny fats in your body. You need to go on an extremely low carb diet or a carnivore diet. That's the best way. Now, one of the supplements that helps with that, Harlow, is our TLC metabolic formula that has berberine in it. And many people identify berberine as the backbone for metformin. And then there's a lot of research about metformin and being low cancer. Uh, because if you have better sugars, you're not going to have mitochondrial metabolic disorders. So you see how this all runs together, and go carnivore on that. All right. And so let's see, what's the last page here if I have a minute or two. Penny says, I'm Dr. Mitchell's patient, wondering about your transcripts using estradiol on my face. I'm 84 with good skin. I use a compounding pharmacist cream. It has 3 milligrams of estriol and 1% retinoic acid, all right, every night on my face and neck. She's increasingly concerning, or she's concerned about thermographies. We decreased my regular topical bioidentical hormones from estradiol 5.8 and testosterone 0.4 to estradiol 3 and testosterone 0.4. When estradiol is applied to the face, I know there's receptors there. Does it also affect the rest of the body? So comparative blood tests would be valid? Yes, it would, and it will affect the body. That's where I put my estradiol. Would I add the suggested minimum of 4 milligrams estradiol to the face while continuing with my topical 3 milligram applied on my wrists? Seems like too much estradiol. Well, you've got to work with Dr. Merrick, and I only put 1 milligram to my face, at most 1.5 milligrams. Now, we're not all identical, and that's why we get lab tests done, and you have to balance it with progesterone. I never give or want to ever give estradiol without progesterone. So if there's 4 milligrams per milliliter in a clicker, and each click, 4 clicks is 1 ml, then each of those clicks represents 1 milligram for a total of 4 clicks equals 1 milliliter. But I only put 1 click to my face, and that's enough to get an adequate level. Any others I would put on the inside of your arms or elsewhere. But talk about that with Dr. Merrick and work that out. But yes, it will absorb through your face and it will work systemically. But I never put 4 or more milligrams to my face. And she went on to say she does very well with her sugar control. Penny also goes on to say, I know iodine is submitted for breast health. I did the iodine challenge and it shows I'm low. Yeah, about 96% of all my patients are low. You seem to recommend 12.5 milligram iodoral. Yes, that's what I do. First, that I've had read that too much iodine can put someone into low thyroid, into Hashimoto's. That is not true. I'm on 15 micrograms of leothreonine, which is pure T3, and 50 micrograms of levothyroxine, which is the precursor T4. You should do fine with 12.5 milligrams of iodoral. That's just the salt. Secondly, that iodine supplement that contains some molecular iodine is a better choice because the molecular goes to the breast first, aiding the breast tissue and sparing the thyroid. So looking forward to your response. Yeah, so iodoral is the salt. It's not the hormone. Dawn says, what are your thoughts on mouth taping to force nose breathing during sleep? I'm all for it. I like that and I agree with it. Are the benefits of nose breathing that significant? Yes, the answer is yes, because it's the air conditioning system before it hits the lungs and many other components. And then finally, Art says, what do I say when well-meaning people ask me, what's the difference between starving and fasting? How do I know fasting isn't hurting metabolism like starvation? Well, starvation is where you have such a lack of food and nutrients, um, like you've seen the little African little black child with that huge tummy. That is they have calories, but they don't have good nutrients. They need primarily protein. And so they start getting edematous and swelling in their stomach. So that's kwashiorkor. The starving, that is just all calories, both carbohydrates and micronutrients and protein and fats. That's called marasmus. And that takes, a long time to kill someone, months worth. So when we talk about fasting, we are not talking about months of fasting. We're talking about stopping eating in an 8 hour or a 6 hour or a 4 hour window, or a one meal a day. So you're always getting healthy nutrients in every day. You would never suffer anything that is associated with the severe life-threatening starvation associated with prolonged multi-calorie nutrient essential fats and protein deficiencies. Okay, so that has nothing to do with what we're talking about. Doing a 24-hour fast, a 48-hour, a 72-hour once a month is very cleansing, and you have plenty of fat to live off of for all your energy, and you do have a wealth and store of micronutrients in general. So with that, I've hit 7:05. I did get through here and our questions, and you should watch your YouTube and look for other venues. Now, we're going to try and work to get secondary ways where I can focus on certain groups of people. Maybe there's a men's group, a women's group. Who knows how it's going to be? We're looking at this. So please stay in tune. Please like and subscribe. And please be blessed. Please take responsibility for this wonderful body our Lord and Savior has given us, and it is designed to heal. Let's take hold of that and go and help our neighbor and our friend and be a good example to them that we can do this. All right, good night. God bless.